Hey guys, it's Justine Buick, the NCLEX tutor, where we help nursing students pass the NCLEX and their nursing exams. I'm a registered nurse and my background is in med-surg nursing and education. So today we are going to go over a case study type of question on the NCLEX. We've had a lot of students take the new NCLEX, and we've done a lot of tutoring with our students, going over these case studies. And I do know that the case studies are a very popular type of question on the NCLEX. So students are reporting that they're getting about 5 of these. I do know that only 3 of them will count though towards passing or not. They also are telling us that they're not super difficult. They're giving you the medical history, any nursing notes, vital signs, labs, medications, orders. You'll get the lab values provided to you, and you also get partial credit. So you just want to make sure you know how to answer these. And this case study, or all the case studies, have 6 questions. And basically what you're doing is you're going through the nursing process with these 6 questions. I know NCLEX likes to call it the clinical judgment model, but honestly, nursing process and that, it's the same thing. So basically, you're going to be assessing your patient, looking out for things that are bad, and then you're going to have to do some planning and interventions. How do we take care of this patient? And then really the last part of the question is evaluation. How do you know if your patient got better or worse? Or how do you know they understood the teaching or not? And remember, every single patient that comes into the hospital or the clinic or wherever you are at as a nurse, they all have problems. There's always going to be some type of medical problem with these case studies. So with this case study, here we have some nursing notes, vital signs. The next page has some labs. And the actual question is going to be, which lab findings require follow-up? So what I want you to do though is read the question, start to look for the things that seem bad, and then tell me what you think the medical problem is. So you can press pause and then read the nursing notes. So I'm going to read it. It starts off with, the nurse is caring for an older adult in the intermediate care unit. And the nurse's notes say that the client was admitted with an exacerbation of COPD, and the client has used home oxygen at 3 liters per minute by nasal cannula for 4 years, but reports increased dyspnea over the last several days. So let me just highlight some things that look pretty bad to me, or the things that I might be really concerned about. The client increased their portable oxygen to 5 liters per minute, so that's kind of getting up there. Currently, the client is fatigued but alert and oriented ×3. Client reports shortness of breath at rest, which actually is kind of common with COPD, but they're having increased coughing and large amounts of thick tan sputum. All right, well, that's not good. So what does that mean? How would you interpret that? Thick tan sputum? I don't know, maybe they're getting an infection too. Client has labored breathing and is in the tripod position. The lung sounds with wheezes bilaterally, so they're starting to wheeze, closing up on them. S1 and S2 heart sounds heard, no murmur or gallop noted, vital signs obtained, and then the healthcare provider in to see the client, and admission lab test completed. Respiratory therapist was in to obtain the ABGs. So of course, I'm thinking they have a respiratory problem, a COPD exacerbation. The heart rate is on the high side. The blood pressure looks fine. Respirations are also on the high side of 24. Pulse ox is 86% on 5 liters of nasal cannula. That's kind of low. What do we like to see oxygen level for our COPD people? Usually between 88 and 92%. And the temp is not high yet. So it doesn't seem like their body is reacting with an infection yet, but they do have that thick tan sputum. So the oxygen is a little bit on the low side. And then when we look at the labs, we know that the respiratory therapist was in to get ABGs. The pH is 7.3. Now, what I want you to do is interpret labs. What does it mean when it's high or low? They're not going to care about you memorizing lab values anymore. They just want to know, can you interpret them? Well, if it's low, that means the blood gas is acidic. And the CO2 is high. It's 67. That's pretty high. So that's also making the blood acidic. HCO3 is normal, and then the O2 is 62, and it's supposed to be between 80 and 100, so that's pretty low. They're not really getting the good oxygen that they need. And then the WBCs are high, 13,200. So that does indicate infection. So I definitely would be concerned about that. And then RBCs and H&H look just fine. So now the question says, the nurse assesses the client, obtains the vital signs, and reviews the labs. Which lab findings require follow-up? Select all that apply. So why don't you pause it here and go through these and see which ones you think require follow-up. Well, first of all, you should look at the ones that are abnormal, right? And think about what is their medical problem. You don't want to forget what their medical problem is. They have what? COPD exacerbation. That's the medical problem. They're starting to have this difficulty with breathing. So we want to pick answers that relate to that. And I call it linking up the answers with what's wrong with the patient with your answers. So the pH was low, and that would be concerning because it was pretty low. The CO2 was really high, and that is telling us they have a lot of carbon dioxide build up in their blood. CO3 was normal. I mean, just get rid of answers that have normal lab findings. The O2 was too low, so I'm going to be concerned about that. Now, what about the WBCs? That was concerning because it's high, and I'm wondering if they're starting to develop an infection. So maybe that's part of the medical problem that I would keep in mind. And then RBCs and hematocrit were normal. So those are my answers. And normally you're not going to know what your answers are after each question. You should find out at the end, but definitely those are the correct answers. Now this question right here, as you can see, it gives you some of the assessment findings. And then would that assessment finding go with hypercapnia or hypoxemia? So this says the nurse reviews the assessment findings and lab results. For each client finding, click to select the finding that is most consistent with the condition, hypercapnia or hypoxemia. Each finding may support more than one condition. So what I'm going to say about this type of question is just go through it once. Don't overpick, because if you overpick, you're going to get points taken off. And if you see anything that you can link up where you say, oh yeah, that's kind of similar, then you could link those answers up. So the pH is 7.3. That was acidic. And which one would it go with? Well, you have to know what these words mean. So hypercapnia means a high CO2 level, which makes the blood acidic. And then hypoxemia is a low O2 level. So we're basically just matching up some definitions here. With the pH or the blood being acidic, I would think that they could definitely have hypercapnia, maybe not hypoxemia though. The CO2, well, it means hypercapnia, so obviously it goes with that one. The O2, it was 62, so that goes with hypoxemia. And then it says the client is fatigued. Well, we know common sense tells us if patients aren't getting enough oxygen, they may not feel like they have a lot of energy. So they could definitely be fatigued. And I think, didn't it even say that in the notes here? The client is fatigued, right? So it says it right there. And also having a high CO2 level in the blood, it's really a toxin that can't get out of the blood through the lungs. And so that can make people feel tired when they have those toxins built up in there. All right, so number 3, complete the following sentence by choosing from the list of options. The client is at highest risk for developing what? So you pick one option as evidenced by the client's what? Now this one right here, you're really interpreting the labs, right? So if we go back and we interpret these labs, what does it mean? What kind of acid-base imbalance do they have? And you should have actually already done that with your interpretation. So we know the blood is acidic. So clearly they have an acid type of imbalance. And then how you figure out what kind it is, well, we know that CO2 is respiratory, HCO3 is metabolic. You just match up your pH, which is acidic, match it up with either the CO2 or the HCO3. You have to find another one that's acidic. And then we go, oh yeah, they have respiratory acidosis. So you should have actually already figured that out before you've even done this question, right? So what would be the answer? Respiratory acidosis. And then you want to link up your answer with the most likely option. How do we know they have respiratory acidosis? What tells us that? Well, it's not the WBCs, even though those were abnormal. It's not the O2, because O2, they don't have to have an abnormal O2 to be in respiratory acidosis. But the CO2 tells you that, right? That's an acid. Now we are in our interventions. So this question says, for each finding below, choose the potential nursing intervention that is appropriate for the nurse to include in the plan of care. Each finding may support more than one intervention. So we have each section here with the findings that we had with the patient, and then you have to pick at least one nursing intervention that would go along with that. So if they have wheezes to their bilateral lung fields, what would we do? Should we prepare them for an x-ray of the chest? Yes, and why? Because that's a diagnostic test. It gives us more information about what's wrong with the patient. They're having some closure of their airway, and we just want to see if we can see anything that's causing that, or how bad is it. And then administer a short-acting beta-2 agonist such as albuterol. Well, you want to know what the med is for. That's a short-acting bronchodilator. So what will that do? That will help open up the lungs. So I like that one. Their CO2 was high. So what are we going to do? How are we going to help fix that high CO2? Teach pursed lip breathing. So remember that, where we have them take a breath and then they kind of blow out slow, and that helps to blow out the CO2 gas. So we like that answer. Administer IV sodium bicarb. What is that med for? And by the way, saying what the med is for is a test-taking strategy. It's obviously knowing content, but it's just a simple little saying that helps you think through answers. And if you can say what the med is for, you are going to be, 90% there with most of your answers just by saying that. Well, sodium bicarb is for patients who have acidic blood, but it's for patients who have metabolic acidosis, and bicarb is a base, and so it'll help neutralize that acid, but it's not going to work with respiratory acidosis, so I'm not going to pick that. And then the low O2 level, the arterial O2 level, how are we going to help fix that? Or at least how should we assess that to see if they're getting better or worse? So place client on continuous pulse oximetry. Yeah, that's going to give us more assessment data to help us see how the patient's doing. And then keep the head of the bed at 30 degrees. So what does 30 degrees look like? So it looks like that. What do you think? This guy is having trouble breathing. And when he came in, don't forget, you can always go back to the notes and look at them. It said he was in the tripod position. What's that? That's like when they're sitting like this, and they just can't breathe. So they sit forward in order to kind of open up those lungs. So do you think keeping them at 30 degrees is good for breathing? No, I'm going to say, cross that out. Let's get them up at 90 degrees. Okay. So that's going to be better for breathing. Large amounts of thick tan sputum. Okay. So what did that mean? How did you interpret that? An infection, maybe they're starting to get an upper respiratory infection. So administer an expectorant. Okay, what is that? What's that med for? That is a medication that gets them to cough up the gunk. So I like that one. And then check for the gag reflex. All right, so you want to stick like a popsicle stick into their throat and the back of their tongue and see if they gag. Do you think that's going to help with the sputum? No, that's definitely not going to help. That's one of those I call a do nothing answer. All right, so now you can see that we have some orders here, and then you're going to do some teaching points, and you have to pick 3 answers. So let's not forget what was wrong with the patient. Well, they have COPD exacerbation, and they had possibly an infection brewing. The nurse reviews the healthcare provider's orders. Continuous pulse ox monitoring. And remember, you picked that answer. So you might see some answers here in the orders that you picked or maybe didn't pick. Don't freak out if you accidentally forgot to pick some answers, or you just didn't pick them and you're seeing them here, or maybe you picked too many. Just be comfortable in the fact that you get partial credit. All right, oxygen via Venturi face mask. Titrate to maintain pulse ox at greater than 88%. Okay, collect the sputum culture for culture and sensitivity. Repeat ABGs at 1800 today. X-ray of the chest. medications, albuterol, fluticasone, and guaifenesin. So it's good to know what all of these meds are for. So what teaching points does the nurse provide regarding the inhaled medications? So we can see albuterol, right, is that bronchodilator, and then fluticasone, it ends in sone or lone, and so that's the steroid that helps decrease inflammation. So we can only pick 3 answers. Albuterol will help remove excessive thick mucus from the respiratory tract. Remember, albuterol was a bronchodilator, so it helps open up the lungs so that they can breathe better. That is an answer, number 1, for the expectorant, which is guaifenesin. So, right, if you just know what the med is for, it's kind of easy to get rid of or keep answers. When using these at home, use the steroid first, then the albuterol. Oh man, what if you haven't reviewed that in a while? It's like, which one goes first again? Okay, just remember, you want to open up the lungs, get them open to receive the steroid. So then the steroid will help decrease the inflammation. So it's written backwards, so not that one. You may notice you feel nervous or your heart rate go up after using albuterol. Okay, well that one starts to kind of seem to go in the realm of side effects. So is that a side effect? I'm not really sure maybe. So maybe you can just question that one. Rinse your mouth with water after using albuterol. I mean, you got to know content, right? So now we're getting a little bit away from just what the med is for, but what are your nursing considerations? What are your side effects? And if you are having a hard time with that, I definitely recommend that you look at my A Nugget Pages book. And so that's a book that we use with our students to review content. And I spent so much time on the meds section to make sure that you knew the most important stuff that you need to know. So, do you rinse your mouth with water after using albuterol? I don't know. I'm just going to question that. Never just abruptly just stop using your medications. Well, that seems like a really safe answer. I think, you want to pick generally good answers regardless of the medication. So generally good it is a strategy and it's very safe. So I like number 5. And then as soon as you inhale the medication, breathe out slowly. Okay, does that make sense for the situation? So they inhale it and then they breathe out slowly. I feel like that does because then it's keeping the medication in their lungs. So I'm going to keep that one. Now, trying to pick, the answer between 3 and 4. If you know you have at least 2 right answers, just be comfortable in the fact that you're going to get at least 2 out of 3, okay? And you really want to get more than half of your questions correct. So that's good. And then, you really have to know the content. It's not the albuterol that you rinse your mouth with. It's actually the steroid. So the steroid can cause thrush to develop in the mouth. So they want you to rinse your mouth out, or they want the patient to rinse their mouth out. And then albuterol, one of the side effects is it causes an increased heart rate and just kind of makes them feel a little bit shaky. All right, and then the last question very commonly is an evaluation type of question. How do you know they got better or worse? So the nurse assesses the client after implementing the healthcare provider's orders, and then check whether the assessment findings indicate that the client's condition is either improved, stable, or not improved. And really, I just keep this so simple. I just say, all right, is that a good finding or a bad finding? And you can go back to the nursing notes to go review if you forgot any of this content. But awake, alert, and oriented times 3. Well, that's stable. That's good. S1 and S2 heart sounds heard. Okay, that's good. No murmur or gallop noted. Good. Heart rate was 96 beats per minute. Oh, right. Do you remember what the vital signs were? So heart rate is 96 beats per minute, and this heart rate was 107. So they definitely improved. And remember, the blood pressure was never really abnormal to begin with, but the respirations were. So let's keep that in mind as you go through these answers. So the heart rate is improved or stable. The blood pressure is good. It went down a little bit. Denies shortness of breath at rest. That's a stable finding. Auscultation of lung sounds reveals wheezes bilaterally. So that is not good, right? And they had wheezes to begin with, so they haven't improved with that. Respirations are 20 breaths per minute, and they were 24, so that's good. The pulse ox is 92% per 50% Venturi mask, so that's good. And then the client is sitting at 90-degree angle in bed, and that is good, right? They were on the tripod, but just sitting up, that's a good finding. And so that is an example of a case study. And then this is just a quick example of the nugget pages with the respiratory meds. And you can see the short-acting bronchodilator here with the albuterol, and then some of the steroid inhalers where they end in "-one" or "-lone", and just some basic information about using an inhaler. So it's really straightforward and easy to read with the nugget pages. Well, thanks so much for watching, you guys. If you're interested in tutoring or getting the nugget pages, you can just go to my website, thenclextutor.com. Bye.